My name is Dr. Donna Waltzman, and I'm a behavioral scientist who studies traumatic brain injury at the U.S. Centers for Disease Control and Prevention.
And my name is Dr. Jill Daugherty, and I work with Donna at the CDC in Atlanta, Georgia. We're excited to be talking today about the paper we recently published in the journal Rural and Remote Health titled Challenges and Opportunities in Diagnosing and Managing Mild Traumatic Brain Injury in Rural Settings. A traumatic brain injury, often referred to as a TBI, is caused by a bump, blow, or jolt to the head or a penetrating injury to the head that can affect how the brain works. In the United States, it is estimated that as many as 12 to 30% of us have had a TBI at some point in our lifetime. All Americans are at risk of experiencing TBIs, but people living in rural areas may be at increased risk for having a TBI and for experiencing worse outcomes after their injury than people living in urban areas. Despite this rural-urban difference, little is known about how healthcare providers practicing in rural areas manage their TBI patients and what challenges they face. Therefore, the goal of our study was to gain insight into the day-to-day experience that American healthcare providers who practice in rural settings have in diagnosing, treating, and managing their patients who present with a TBI. A series of interviews and focus groups were conducted with 18 providers with a goal of informing rural TBI prevention and communication efforts. The healthcare providers who participated in our interviews and focus groups were firm in stating that they were comfortable diagnosing, treating, and managing their patients who presented with a suspected TBI. However, they also indicated that they faced many challenges managing TBI in their practice. Among rural providers in our study, the two main issues discussed were a lack of resources in their communities, for example, specialists who can treat TBI, and that patients often did not recognize the seriousness of their injury.
So the healthcare providers in our study said there were still lingering misconceptions about the injury and not insignificant amount of denial about the potential seriousness of a TBI. On surveys, when asked why those with a suspected TBI did not seek healthcare, many of these people will report it was because they didn't think the injury was serious. But it's always important to be evaluated by a healthcare provider after sustaining a suspected TBI. A healthcare provider can assess the patient for more severe injury and provide discharge instructions for managing symptoms and safely returning to daily activities. There are actions that public health professionals and clinicians can take to educate the public about TBI. Based on our study, education is needed for the public at large, and perhaps for parents in particular, about the potential seriousness of TBI and that seeking immediate evaluation is important. Healthcare providers reported that the common causes of TBI among their patients were similar to the general population: sports, work-related injuries, and falls. However, all-terrain vehicle and rodeo-related TBIs were also commonly mentioned by healthcare providers in our study and may be unique to rural areas. State and local public health agencies may find partnering with national ATV and rodeo groups to provide concussion education helpful in reducing TBIs in these areas. The bottom line is rural residents may be at increased risk for sustaining a TBI and may not seek healthcare for a TBI in their communities. However, rural healthcare providers routinely manage TBI treatment for their patients. Effective health communication tailored for rural communities about TBI prevention and treatment may help improve the health and well-being for rural residents, especially for those who participate in recreational activities that may increase one's risk of sustaining a TBI.
Thanks for listening today.